WHO has, in agreement with the member countries, has declared this decade of healthy aging. So, and this falls within the context, within the mandate of Development Agenda 2030, which we know through its Sustainable Development Goals. So, because this concept and its implementation has become extremely important in the context of SDGs, I wanted to speak briefly today how this could be implemented in the context of Pakistan. And I know other people, especially Dr. Safdar Suhail, Madam Shahida Jamil, and Shafqat Ahmed Saab, you will also be reflecting on this matter. Continuing, and I will at the end draw some conclusions referring to the dementia challenge. So I hope you will accept that a little change of topic. So the first question is, what is healthy aging? But before, can we move to next slide? Before I go on to make a full presentation, may I give you the takeaway messages? So these are the conclusions which I would have drawn at the end of my presentation, but I want to mention them right at the outset because that will define the agenda of what we are talking. So all the other details would lead to these two conclusions. And the first one is there is no delay we should have. We should urgently adapt the policies, our policies, existing public policies, so that we could support a rising number of older population in Pakistan. Next. And that we can do by adopting WHO's healthy aging principles, which implies that we should have better geriatric health care, we should have better social pensions for all, and we should come up with age-friendly environments in our country. And by doing so, we can ensure a dignified, independent, and healthy status for our older population. Next. So what is healthy aging? And many of you would most likely know this definition already. It talks about a process of developing and then maintaining a concept called functional ability. Many of us can understand such a concept, that how do we go about carrying out our day-to-day tasks. And these functional abilities should enable a higher well-being in older age. Next. And what do we mean by functional ability? It is shaped by intrinsic capacity, which is about physical and mental health, and to large extent determined by our lifestyles during earlier ages, but also by provisions of preventive care, and that determines our physical and mental health, which we refer to as intrinsic capacity. But the second factor is environmental factors, which are about what public health care policies are available, what family support is available in the culture of the country that we live, and what age-friendly infrastructure might be available around it. So you can imagine that intrinsic capacity could be affected almost the same way for many people getting older, but when those intrinsic capacities interact with public healthcare policies, with family support available, with age-friendly infrastructure around, then we become more functional in our old age, despite frailty, despite occurrence of more often disease. So this is the interaction of our intrinsic capacity with the environment within which we are living. So if we are aging in Lahore, that would be different than aging in Stockholm, because the environmental factors are much more supportive to older persons in Stockholm. And then the third factor, which is probably the most important, is the personal behavior. And those are not just the personal behaviors once we have reached old age, but it's a lifetime phenomenon that we need to watch out what we eat, how often we do exercise, and what kind of social relations we live with. Next. So basically, WHO's healthy aging concept is helping us take the focus away from increasing life expectancy to ensuring that older people remain independent, active, and contributory towards their societies, towards their families, towards their communities. Next. So those were sort of initial context, but let's look at what is the Pakistan's context in terms of number of older persons. And we see that in the current period, the latest credible data that we have is for 2023. That tells us that there are, in single digits, 7% of people are age 60 or above. Age 60 or above can be contested to be the definition of old age, but this is the definition that is used by UN statistical offices, and this is the definition very often used in our statutory retirement policies, certainly in Pakistan. But I would disagree that age 60, in my view, is too young to start calling people old age people. But using that definition, we see that from this day to 2050, in 25 years' time, the population of older persons would rise from 16.5 million to almost 36.5 million, 3 times as much. This is real concern. And in some presentations, I say that a tsunami is waiting to happen. We are aware it will be happening, and we are doing very little to actually prepare for it. So today's seminar in that respect is also extremely relevant, and we are very thankful to MARAT for organizing this awareness seminar. Next. If you look at the life expectancy, we could see that the life expectancy is on the rise. From this year to 2050, we see, for instance, let's just take one example of females. So females' life expectancy is rising from approximately 70 to 74 years. So in this period, we are observing 4 additional years added to the life of our females, and similar figures you could say for males, slightly less, maybe 3 years. So healthy aging concept is WHO's healthy aging concept implies that we need to really add life to these years, to have more healthy life added to these years, and that could only happen if we bring about certain changes that would help us implement healthy aging. Next. So I'm just focusing on recommendations. I'm not going into any further details. First and foremost, the geriatric healthcare needs improving. And this means more doctors should specialize in geriatric medicine. We should establish specialized healthcare units for older persons, and we should expand health insurance for elderly population. So and we know that given the current system, there is very little specialized care for older persons. And given the rising number of older persons, we must bring about this improvement in our healthcare system. Next. We should also expand our social protection. And this means we should implement universal social pension schemes. We should provide social assistance, financial assistance for low-income seniors. We know income is one of the strongest predictors of people being active, engaged, and healthy in old age. So this will need to be strengthened as well. And I'm sure Dr. Safdar will be talking further about this. Next. And it goes without saying. I heard that Dr. Shafqat and Dr. Shaida, Madam Shaida, will be talking about this as well. We need to bring about changes in our lifestyles. And this is not just changes for older persons. This should be middle age, early age, young. We should have better lifestyles in terms of diet, in terms of exercise, in terms of social engagements. In particular, in old age, we should come up with community-based programs. So I live in Model Town in Lahore, and I'm suggesting, and I see lots of groups active in the Model Town Park, and I'm suggesting more of such community-based programs should be implemented so that people in old age continue to live a healthy lifestyle. And we should also come up with public health awareness campaigns to combat ageism, because very often the mindset is that older persons do not need to do all this. They should just sit at home and not be as engaged as healthy aging principles are implying. Next. And of course, we should strengthen elderly care services. And that means especially for those who require home care, but we also need to provide caregiver training for families. Last slide, thank you, please. Thank you. Next one. And I bring about all this, that we need to establish a National Commission on Aging to coordinate public policies in private sector, public policies and private sector initiatives. Next. And all of this will happen if we, to start implementing and enforcing senior citizens welfare acts, which are in place, but they are not implemented or enforced across all provinces. To my knowledge, they have been implemented or put in place in KPK and Sindh, but there is very little implementation of it. Thank you so much.